The breast is supplied by the internal mammary and lateral thoracic arteries. The first internal mammary branch to feed the breast is the second intercostal artery. It enters the nipple areola complex at about the 12 to 2 o'clock position. This vessel travels superficial, 1 centimeter deep from the skin surface, supplying the nipple areola complex. If this is the only blood supply to the breast, it is known as the superior pedicle. The pedicle preserves 3 to 4 centimeters on either side of where the vessel enters the complex, creating a 6 to 8 centimeter pedicle width. The rest of the glandular tissue can now be incised safely. The medial pedicle is supplied by the third intercostal artery. The artery enters the complex between the 2 and 3 o'clock positions. This artery is also considered a superficial arterial feeder. It can be seen 2 to 3 centimeters from the surface of the skin. The pedicle created is 3 to 4 centimeters on either side of where the third artery enters the complex. Medially, the pedicle starts at the mid-level of the medial pillar to be created and laterally to the 1 o'clock position. The base is from the 1 to 4 o'clock position. The rest of the glandular tissue can now be safely incised. The superior medial pedicle preserves the second and third intercostal arteries. This is a very hardy pedicle with excellent blood supply. Medially, the pedicle starts at the mid-level of the medial pillar to be created, 4 o'clock position, and laterally to the 11 o'clock position. The base of the pedicle is from the 11 to 4 o'clock position. The rest of the glandular tissue can now be safely incised. The inferior pedicle. The only artery that enters the breast from its deep surface is the fourth intercostal artery. This artery will provide blood supply to both the inferior pedicle and central pedicle. The artery will traverse the breast tissue and not the fatty tissue. The inferior pedicle is also supplied by the superficial fifth intercostal artery. This artery enters the base of the breast in the fatty tissue zone and is considered a superficial vessel. These two arteries supply the nipple areola complex in an inferior pedicle. The pedicle base is 7 to 8 centimeters, centered on the breast meridian. The rest of the glandular tissue can now be safely incised. In the central pedicle, the main blood supply is the deep fourth intercostal artery because the fifth superficial intercostal is usually transected. The breast incisions are circumferential, and the nipple areola complex sits on an island of central tissue supplied by the fourth intercostal. In the lateral pedicle, we preserve the superficial branch of the lateral thoracic artery. The pedicle is about 6 to 8 centimeters wide in its medial portion. The pedicle begins at about the 11 o'clock position and continues laterally to about the mid-portion of the lateral pillar. The rest of the glandular tissue can now be safely incised.